2009 is going to be a challenging year both for individuals and for organisations, and I just wanted to take this opportunity to let you know some of the things that your association will be doing for you, its members, during the coming year. The main feature dominating the news this year, and I think for the coming many months, is going to be the financial crisis and the credit crunch. And although doctors are probably more protected than many other people in their jobs, it's still going to be a challenging time. And we still, of course, have this government's obsession with using the commercial sector and markets to run the NHS. It does strike me as bizarre that exactly at the same time that the government seems to be taking the banks into public ownership, they're still trying to flog off parts of the NHS to the private sector. The BMA will be continuing its fight against the commercialisation of the NHS, and we'll want your support in that fight. One of the issues that's going to affect our doctors in training is the implementation of the European Working Time Directive. We're very anxious to ensure that all trusts are ready for this, and we do have concerns about some of the trusts' preparedness. We certainly don't want to see doctors' training adversely impacted on. We want to ensure that our doctors come out as well trained as they've always been, and we'll be taking steps both nationally and locally to make sure that junior doctors are protected and supported in their discussions with trusts. Another feature this year will be the ongoing implementation of the Darzi Next Stage Review. And although there are some encouraging aspects to this in terms of raising quality in the NHS and having more clinical engagement, there is the ongoing worry about the effect, particularly in primary care, of the Darzi health centres. We've not only been supporting GPs already, and we had the campaign last year, but once we've seen the results of the bids for practices, we'll be continuing our support to try to ensure that there is no destabilisation of existing GP practices. One thing I've been anxious to do since I became your chairman is to improve the quality of support we give to doctors locally. That not only means supporting regional councils so that you can have more of a say locally, but it also means trying to tailor the services that we offer you much more to the individual. Now, this takes time, and of course it costs money, and the last thing I want to do is to be raising your subscriptions. So it means we have to make savings elsewhere, like any other business, but I'm pledged to continue to improve the support that we give doctors locally, whether it be to do with their contract negotiations, to do with their professional development, or to do where they feel threatened by changes that are happening as a result of commercialisation in the NHS. One major group of doctors who are going through contractual change at the moment is, of course, the staff and associate specialist group. Since the agreement on their new contract, we've been working hard both nationally and locally to ensure that that change happens as smoothly and as effectively for our SAS colleagues as possible. In many areas it has been carried out quite successfully, but there are others where there's been quite a degree of foot dragging, and again we are offering information, support and guidance to SAS doctors to ensure that they get the best deal out of their new contract. If any of you have any problems with your contract, please let us know and we'll do our best to help and support you.